Now, this is a very odd and very interesting CT scan of the brain. We can try to pause the video and you can try to find out. What first thing, this patient was around 35 years of male who presented with altered mental status. And his GCS was around 8 out of 15. The patient was not able to talk and patient had convulsions. Now, when we see that the ventricles do appear much enlarged, so this is both first and second ventricles. For the age of 32, they look much enlarged. The second thing which we can see is when we see there is much hyperdensity or dense white appearance of this subarachnoid space. This is a very typical area of subarachnoid space where we should be able to find out the sulci and gyri, but here the sulci gyri are not at all apparent because of the cerebral edema and presence of this dense white subarachnoid hemorrhage. Now we can see this in here. This is very clear, crystal clear. This dense white structure is all blood which is out there. Now we know this is middle cerebral fossa and this is posterior cerebral fossa. As we can clear cut make out the difference between the two, that this is all bone. So this is middle cranial fossa and this is posterior cranial fossa. So the demarcation between the two must have been very crystal clear, but here because there is hyperdensity, you can see that there is hyperdensity, diffuse patchiness, and this is all collection of blood or spillage of the blood into the subarachnoid space. So this is very typical case of subarachnoid hemorrhage. Other thing which we can see, this is the first ventricle, this is the second ventricle. The third ventricle we can find it in between the two thalamus. These are the two thalami. So in between the two, what we can see is a third ventricle. So we can see first ventricle, second ventricle, third ventricle, and this third ventricle then passes to the spinal cord as a fourth ventricle. So we should be able to see this fourth ventricle at the level of pons, below the level of pons, but here we are not able to see that. So this is pons, this is pontine part we can see because this is perfectly almost circular, and behind that, or we can see this is the fourth ventricle. But here we are not able to see that fourth ventricle. It is very small. It is very constricted here. The fourth ventricle is not apparent. Here it is not apparent. And this is all medulla because this is the exit from the brain, because we can see the brain is all ended. Now the spinal cord will start. So this is medulla. In medulla, we are not able to see that fourth ventricle. So here you can see the small opening, but in here there are in so many cuts. The fourth ventricle is not at all there because of the compression, because of the cerebral edema, or because of the cerebellar edema, or because of the simple posterior circulation hemorrhage that is in the subarachnoid space. Now, the subarachnoid space is almost always because of only two things. It is mostly aneurysm from a particular artery. Aneurysm is an abnormal and a weak dilatation of a vessel. So if this can be any vessel, it can be ICA, it can be pica, it can be posterior cerebral artery. So this artery, if it is congenitally ballooned out, it will be very thin, it will be very fragile. So if there is excess of pressure, this will burst, and this will burst into the subarachnoid space because all these vessels, the circle of Willis is present in subarachnoid space. So this can be either aneurysm of a particular artery of posterior circulation, or it can be the second thing, it can be a arteriovenous fistula. So artery which will be around external carotid or internal carotid, and the venous is, it can be any sinus venous, venous sinus. It can be dura mater, it can be sigmoid sinus, it can be um, the transverse sinus. So these sinuses, if they have an abnormal connection with the arteries, they can form a fistula, and the fistula, as the arterial pressure is very high, these connecting to these venous channels, they can burst and they can also bleed into the subarachnoid hemorrhage. Now, how to suspect whether this is an arterial or this is a dural sinus fistula, dural arteriovenous fistula? If it is arteriovenous fistula, which is getting connected to sinus, sigmoid sinus or transverse sinus, then we can see, as these veins are very, very thin, we can see the tortuosity of the venous sinuses, because these sinuses are actually veins. So if there is excess of pressure into the venous channels, you will automatically be able to see these veins. This is just like caput medusae, which we see very commonly in ascitic patients, in CLD patients, or it is just like the esophageal varices, where these veins will be dilated and they will be tortuous. So what we can see in this particular CT scan, there are, if you try to see in here, there are multiple small dilated venous channels which are very, very well appreciated. So this is basically one of the channel. You can see this is one of the venous channel, this is one of the venous channel, and this is also one of the venous channel. So there are multiple venous channels which are out there. So this is very highly likely that it can be this transverse sinus fistula, which may be communicating with the external carotid artery. So this is a very, very, very interesting CT scan with a very high possibility, very high likelihood of a dural sinus based arteriovenous fistula, mostly sigmoid or transverse sinus fistula, which was ruptured, causing subarachnoid hemorrhage and obstructive hydrocephalus. Now, this subarachnoid hemorrhage can be very well appreciated in this CT scan. So, this is the CT scan of a different patient. This patient had a hypertensive bleed, which we can very nicely make out. This is very typical putaminal bleed. But here we can very see the posterior part. Everything is very, very well localized. This is pons, because the pontine part is perfectly circular. You can see the start of the fourth ventricle, and you can trace the fourth ventricle here, here, here. You can very well trace it up to here, here. This is the fourth ventricle, this is the fourth ventricle. You can trace the fourth ventricle very, very nicely. But in here, the fourth ventricle is not traceable. You can see the pons, and just behind that, you can appreciate the fourth ventricle beginning. But in here, the fourth ventricle is not at all apparent. So definitely there is obstructive hydrocephalus. And apart from that, what we can see, the age difference is definitely there between these two patients. But what I want to highlight is, see this in this image, see this part, there are so much of sulci, which we can see very well. There is so much of sulci in here, and these sulci are all black. For example, these are the sulci which are black because there is no blood. We know that whenever there is presence of blood, it will look hypertense. But in here, what we can see, that this sulci appears so hyperdense or so white because of presence of blood. And the sulci and gyri presence is so much less in these images, because there is so much of blood in the subarachnoid space, as well as there is cerebral edema. That is the reason why the sulci, gyra are almost absent in this image, because of the presence of subarachnoid hemorrhage and the cerebral edema. So this was a very interesting case, a very rare case, who had around a dural based AV fistula having subarachnoid hemorrhage and obstructive hydrocephalus. Thank you.